Hi, my name is Dr. N. Edward Duran, and I wanted at Pathways Fertility in Atlanta, Georgia. And I wanted to spend a few minutes talking about reproductive surgery and how it can help patients with infertility and other reproductive issues. So the important concept is that conditions like endometriosis, fibroids, adenomyosis can have a very detrimental effect on reproductive outcomes. It can make it difficult to achieve a pregnancy. It can contribute to a miscarriage and even lead to obstetrical complications like premature delivery. Fibroids are very common. 70% of reproductive age women have fibroids, and not every fibroid needs to be removed, but depending on the size, the quantity, and the location of the fibroids, fibroid removal may be essential in order to allow pregnancy to occur and to prevent a miscarriage. The important thing is that starting in 2006, the FDA approved the use of the Da Vinci robotic operating system to allow minimally invasive surgery to remove fibroids. Up until that point, the majority of fibroids have been removed with an open C-section-like incision that causes a lot more bleeding, higher risk of infection, and most importantly, a lot of scar tissue formation. Approximately 80% of patients that have an open cut myomectomy end up having scar tissue formation where the intestines often stick to the tubes, the uterus, the ovaries, and actually can prevent pregnancy. So on the one hand, you're trying to enhance fertility by removing fibroids, but you're causing infertility by doing surgery with this old-fashioned technique. By using robotic surgery, we're able to do all the surgery laparoscopically through small incisions in the belly button. And that allows us to work in a closed humidified space where we're able to remove the fibroids, repair the uterus in multiple layers, and at the end of the day, there's 1/3 as much blood loss. There's virtually a zero risk of infection. The patient recovers in 1 week instead of 8 weeks or 6 weeks, and patients often go home the same day compared to an open incision surgery where they're admitted to the hospital for 3 or 4 days. But the most important part of minimally invasive robotic surgery when it comes to fibroid removal is the risk of scar tissue formation is much less. It's on the order of 10% compared to 80%. So what that means is that you can effectively remove the fibroids while maintaining or restoring fertility in patients that weren't able to get pregnant before. And you're not going to have the subsequent intestinal scar tissue to the uterus and reproductive organs that we see with open surgery.